What are the options for meeting the 75% data completeness requirement for CQMs if one practice uses paper records?
By now, most of you are aware that the Medicare requires that you access data and report clinical quality data for at least 75% of your patients eligible for each measure. Your submission will be invalid if your reporting falls below that 75% data completeness threshold. And there goes the shared savings. There are a lot of great reasons to choose to submit MIPS CQMs or Medicare CQMs over eCQMs, and this is one of them. A registry building a MIPS CQMs or Medicare CQM quality submission for your APP can blend manually abstracted data from your practices on paper charts with electronically extracted data from your practices on certified EHR technology. In our experience, likelihood of being on an EHR increases with practice size, so it's likely to be your smallest practices that are still on paper charts. In many ACOs, less than 25% of patients are seen in non-EHR practices. If you fail to get data from your practices on paper, you're still likely to meet your 75% data completeness threshold. I would not, though, suggest that you give your practices on paper a pass on this requirement. Expect them, contractually require them to contribute to the ACO, to your ACO quality reporting effort. Your practices on paper charts should expect, by staying on paper, to have to manually abstract charts to do annual quality reporting. They probably have already been doing a manual abstraction for MIPS, annual MIPS reporting. Keep up that expectation. Now, it's not just your practices on paper that you'll be concerned about. In fact, you might even have a bigger problem with practices of EHRs from which it is not easy to extract data. You're going to find many providers on EHRs, particularly in those smaller practices. Well, I'll take that back. I see that problem everywhere. Big practices, small practices, providers do not always follow recommended documentation practices, and data ends up in places inaccessible to your quality reporting. So this is where you should be thinking Medicare CQMs. With Medicare CQMs, you're only reporting on Medicare patients. On the average, that is a little less than a third of the number of charts that you have to abstract that you'd have to do for an all-patient, all-payer MIPS CQM submission. Now, to link this back to other conversations, this should be addressed contractually in your data governance contractual requirements. Small practices will continue for the foreseeable future to get a pass from Medicare from the requirement to use certified EHR technology. Even when Medicare is requiring ACOs to have 100% EHR use, that's not going to apply to your smallest practices who are given a pass because of their practice style, the specialty mix, their non-patient facing status, or the size less than 15 providers. But your ACO does not have to give them a pass from that. Everyone in your ACO should have a plan and steadily work toward the goal of implementing certified EHR technology. You may year by year extend that, well, we're not going to require it this year, but it should be an expectation that you work steadily toward that goal. Now, you might spend some of your data in completeness allowance to build a successful year-to-year submission. You should still contractually expect all of your practices to contribute data. Keep that 25% allowance special to you that you can apply as you need to. Don't promise it to anyone or combination of your participants.